Bipolar disorder. Bipolar disorder, or manic depression, is a psychiatric disorder of the brain that makes an individual have occasional mood swings. Individuals affected with bipolar disorder experience manic episodes where they enter a depressive state, sometimes mild or can be severe. In Florida, a lot of adults are known to have a history of drug abuse, mental health, and a long term life of addiction. These risk factors make a person with bipolar disorder feel as if they are threatened without the sense of doing for themselves. They have the will to make it on their own, such as financial ability. Many may feel that if they are middle aged, that it's too late for them to achieve their goals. These are level barriers that make them feel insecure. Many adults with bipolar disorder are high risk for suicide. Bipolar disorder can be hereditary. 80 to 90% of people with bipolar disorder have a relative with depression or bipolar disorder. Treatment for bipolar disorder involves diagnosing the problem and finding the right medications and treatment interventions for the person. Just as everything else, each person has to be treated differently. Many cases may not be as severe as the next case. Florida has intervention programs such as Quest Counseling Center, Bipolar Disorder Treatment Program, and Altamont Springs Bipolar Disorder Treatment, and outpatient substance abuse treatment, the drug rehab program for bipolar disorder. Also, the Tri-County Human Services Incorporated, Avalon Park Bipolar Disorder Treatment Program, and the Bipolar Treatment and Residential Long-Term Treatment, which is more than 90 days, long-term substance abuse treatment, and long-term drug rehab program for bipolar disorder. Although bipolar disorder is a lifelong disease, an individual with appropriate treatment can live a normal life depending on the extent of their condition. With proper treatment, many people with this disorder can live a good life and even get a job and go to school or college. The more education a person has, the better they are at adapting to the disorder or to helping a person with the disorder. Management includes medication and psychosocial interventions. This helps to prevent further occurrence of the mania episodes. Learning to recognize potential stressors and triggers before an episode happens is an intervention method. Cognitive behavioral therapy helps an individual to learn to monitor their behavior, thoughts, and stressors. Interpersonal and group therapies are groups used to help gain insight into their management, establish health thinking, maintain interpersonal relationships, and to explore the efforts of the condition. These self help groups are also build confidence and self esteem. It helps to maintain a wide variety of groups to help with management of bipolar disorder. There are social support networks that with family and friends, community groups and organizations, religious affiliations, and support groups that help to manage the conditions. Education is the key to learning how to deal with existing diseases such as bipolar disorder. Learning firsthand is the best teacher. It is one thing when you are reading about a condition, but it is another thing to actually experience it. Going to these groups and counseling sessions are great learning tools. The Intervention America website gives you a list of organizations and their phone numbers where you can choose from and get second opinions, counseling, information, and education. The list was so long as a person can only choose a few. There are long term and short term help facilities a person can go to for help to get better. It all depends on the amount of treatment needed. Some may be so extensive that they need treatment for the rest of their lives, or just short term until they can do better after treatment. Drug rehab programs accept people with bipolar disorder. Having a good support group helps a person with bipolar cope because it makes them feel like they have a reason to get better or someone by their side who really cares and loves them. These members could be family, friends, spouse, significant other, or even the counselors. Oftentimes, people with illnesses such as schizophrenia and bipolar disorder go untreated because many people fear the sense of belonging and feel ashamed. However, treatment of the illness in the early stage will restore the sense of security and confidence in a person stricken with bipolar disorder. The end.